So, what would the risks be involved with surgery?
Yeah, so surgery for strabismus is, we've been doing it for 100 years, so it's tried and true. If you think of eye surgery or eye muscle surgery, you've got medial rectus, lateral rectus, so a middle muscle and an outside muscle. And those are a bit like the reins on a horse. So if you want to move the eye from pointing inwards to pointing outwards, you need to loosen off this side and tighten up this side. And we can either do that by operating on 2 muscles in one eye, or we can do 2 muscles across the 2 eyes. And I tend to do both eyes, 1 muscle surgery, because you're doing a little bit less surgery on both eyes, and it's more balanced between. Thinking that there's not actually a problem with the eyeball or the eye muscles, it's a coordination problem between the 2 eyes. So doing a little bit of surgery on both eyes has sort of a more balanced outcome. So for an interned eye, I go into the middle muscle and just move that muscle back a little bit so that the eye can relax and straighten up. Right. And so the risks of surgery involve the surgery itself. So anytime we do an operation, there's a risk of bleeding or scar tissue forming around the surgical site. They're pretty unlikely to be significant. There's always a risk of infection. So if a child gets an infection around their eyes, we treat it with oral antibiotics. And again, usually, because it's on the outside surface of the eye, it's not going to damage the vision.
Right.
And then there's the risks of having a reaction to the Vicryl or any of the other medications. Again, usually we can just manage that with a little bit of steroid and things settle down. And then the final thing is the very rare risk that something else happens during surgery that was unintended, unplanned. And most of the time we can manage any of those complications without long term. So overall, it's very, very safe surgery. The hardest thing is really getting the target right. So in a 2.5-year-old, we were trying to measure how much their eye's turning, and they're not focusing properly on our targets when we're trying to measure. We like to get a set of 2 or 3 measurements which are consistent, so that at least we're starting off operating on a turn that we can measure. And if we're getting measurements that are all over the place, it's probably safer not to do the surgery.
Cool. And so what's the recovery like?
Yep, so usually the first 24 to 48 hours, kids are pretty grumpy. And we do the surgery under general anaesthetic, I should say that, but it's just day-stay surgery. You don't have to spend the night in hospital. But their first 24 to 48 hours, their eyes feel sore and gritty and they're a bit miserable. And then I recommend most people take a week off school, just because your eyes are still feeling a bit puffy and red and a bit achy and you're a bit out of sorts. And then 2 weeks off swimming, or really trying to avoid getting any sort of dirty water, muddy play, that kind of thing. So for some younger kids, that might mean 2 weeks off daycare because you can't control them. And the other thing lots of parents ask me is about rubbing the eyes. And the stitches that I use on the muscle are very strong. So I would never say never, but most kids, they wouldn't get in there and rub their eyes to the point that they undo the muscle surgery.
Right.
That's all very safe and secure. But the superficial layer where the conjunctiva is, it's a bit like the skin of the eye, where that comes together, it's very easy to displace that. Again, most kids will heal up really beautifully. It wouldn't matter. We wouldn't take them back to the operating theatre to try and close that up. But that's why we try and avoid eye rubbing if we can.